The population is aging rapidly, and we believe more needs to be done to address increasing inequalities and complexities of supporting citizens with rare diseases and long-term health conditions. When we were founded in 1834, we set out to help and support our world by actively promoting a positive change in society. Through our leading research into management and treatment of diseases like cancer and our partnerships with other universities, research centres and the NHS. Find out from our colleagues, partners and stakeholders about how we're making a difference in ageing and health.
Increasingly, we are recognising that it's important to take a life course approach to ageing.
Research is absolutely vital. It's crucial if we're going to tackle the very deep inequalities that we face.
It's the first time in human history this planet is facing so many people aging at the same time together.
My name is Avanai Hirseya. I am William Leach Professor of Geriatric Medicine at Newcastle University, an Honorary Consultant Geriatrician at Newcastle Hospitals, and Director of the National Institute for Health Research, Newcastle Biomedical Research Centre, where we have a vision of improving lives through world-class research in ageing and multiple long-term conditions. The UK population is ageing, and of course this is a great success story. It means that many more of us are living long, healthy and fulfilling lives. However, whilst many people are well until their 80s and 90s, others are not so fortunate and may develop single or indeed multiple long-term conditions. Therefore, our mission is to understand why these conditions occur and also learn about how to identify them, treat them and indeed prevent them.
My name's David Byrne. I'm the Pro Vice Chancellor for the Faculty of Medical Sciences at Newcastle University, and I'm also Director of Newcastle Health Innovation Partners, which is our academic health science centre. With regard to the broader health agenda, we clearly can't be good at everything, but what we are very good at is what we call translational research or translational medicine. And that involves pulling discoveries through from the bench, or the laboratory if you will, into population benefit through clinical trials. Newcastle is particularly good at shaping early phase studies with industry to help them create groundbreaking outputs that will benefit populations, not only in the North East, but in the UK and internationally.
My name is Jackie Daniel. I'm Chief Executive Officer at Newcastle Hospitals. Research is absolutely vital. It's crucial if we're going to tackle the very deep inequalities that we face. So it's really important for me as a hospital chief executive to make sure that our care and our services are keeping at the forefront of modern medicine, at the forefront of using new technologies, drugs, care and treatment that we can rapidly translate for the populations that we serve.
So the partnership between Newcastle University and Newcastle Hospitals is key to doing strong translational research. Seeing patients and the problems that they are experiencing absolutely informs the questions that we need to answer. And equally, once we've answered questions, they need to be taken back into clinical practice. And the Newcastle Biomedical Research Centre is a partnership between the university and the hospital where we carry out translational research on ageing and multiple long-term conditions.
The collaboration between the Hospitals Trust and the university goes way beyond our two organisations. So patients comment on the strength of the collaboration all of the time. So we have a lot of patients that we recruit into clinical trials. We actually actively encourage patients to get involved in research in Newcastle, which they do willingly, and we're very, very appreciative and lucky about that. But what they also often comment on is the leading edge care and treatment that we're able to offer as a result of that. We also have a lot jointly in terms of medical and other professional education and training. And obviously that is really, really important that we can be the best organisations, really attract the best people to come and train and learn in Newcastle, but then also hopefully to go on and work within our outstanding hospital.
Another really important element of our work in Newcastle is to be outward facing and to be networking more widely.
I am Nick Palmarini. I am the director of the UK National Innovation Centre for Aging. First of all, we framed the concept of aging intelligence, meaning that we want to add intelligence to aging and longevity. And intelligence, we think it's a key, it's one of the assets that the university has. And intelligence is the intelligence of the people, it's the intelligence coming from data, it's the intelligence coming from evidence. All this is possible because it's empowered by the research at the university, allow us to source and, as we say, translate in the real life of the people. We at the center are partnering with Piaggio Fast Forward, which is a company of Piaggio Group, the producer of Vespa, and now the owner of Moto Guzzi and Aprilia, for example. And with them, we're working around the first device that they have developed, which is called Gita. Gita is a robot which is able to follow you. You can load it with almost 23 kilo of things like grocery, for example. And it's very interesting because it's a very smart technology, but very simple on the other hand. What we're testing here, the research that we're doing is, can this technology help older adults to live a better life, to be stimulated to walk more, to be more socially connected? And it's exactly what we're doing now. And the feedback we're collecting are so interesting because we're forecasting, envisioning the future of mobility, of urban mobilities. And we think that this type of device will be part of our life in the next 10, 15, 20 years. So what it will be the impact over us, over the society, and over an aging population.
We work in particular with the National Institute for Health Research in areas such as our Biomedical Research Centre in Aging and Long-Term Conditions, and also, of course, through our Academic Health Science Centre, which includes the City Council, notably, as well as our 2 hospital trusts and the Academic Health Science Network for North East and North Cumbria. This creates a really powerful partnership within the region, but also networks us in nationally to allow us to tackle and contribute significantly to more national-based problems as well. I take immense pleasure about seeing our younger researchers and educators coming through and succeeding. And if I can help some of them in some small way to succeed, then that is an incredibly rewarding part of my job.
The thing that inspires me most is the ability, and this is very evident in Newcastle with the strength of the partnerships, the ability to make a difference. The ability to make a difference to today's care and treatment for patients, but the ability when we work collectively to change the prospects, the future generations, the families that we serve in living a much healthier life and much longer into the future. And that's got to be worth getting out of bed for.
Well, I know I'm lucky. I think I'm doing one of the best jobs in the world, probably in the best place in the world where to do my job. So that's what makes me waking up every morning with a smile over my face.
What I really love about my job is using the research that I do to make a difference to the lives of my older patients.